My name is Dr. Dan Craviotto. I'm an orthopedic surgeon, and to my left here is Dr. Lisa Chu. It is our fourth day of our summit at the Summit Conference, a national grand rounds on the state of American medicine. So welcome, everyone. I think we have a pretty exciting day today with some great speakers, and we appreciate you joining us. As we've done the last 3 days, we usually open up the morning with kind of a recap. And so there were some major themes that came up yesterday. And so if you weren't there, if you weren't listening in, we just kind of want to recap some of those and have an honest discussion about them. So let me just kind of highlight them, and then I'm going to turn it over to Dr. Chu. Some of the things we heard is the whole topic of why don't doctors speak up? And some of the speakers who were on and in our question and answer period had some pretty, I don't know if harsh is the right word, but some pretty convicting words that physicians and medical organizations have no guts to speak up, that we don't have courage, and that, in fact, physicians are cowards. And to anyone who's listening out there, those are not my words. That's how we are looked at by perhaps some other physicians, but then from people who are not in the medical community. So with that, I'm going to turn it over to Dr. Chu. She was here with us yesterday. She was in the room, and she was kind of chronicling and writing down her thoughts as all of these discussions were occurring. And so I'm going to turn it over to Lisa, and we're just going to have a chat here about these issues and what it means. So Lisa, thanks for joining us this morning.
Thanks, Dan.
Yeah.
It's great to be here. My name is Lisa Chu. Just a little bit of background for those of you who are seeing me for the first time. I am a physician by training, and for the last 6 years I've actually been a life coach to physicians who are in various stages of burnout and career transition. So really my vocation at this point is coaching people through their fear. And so I was very, very intrigued by the emotion of yesterday. And we heard from two courageous leaders who have taken specific actions to create initiatives to right the wrongs, so to speak, that they're seeing in medicine. And then we heard from a Newsweek reporter who wrote an expose on the American Board of Internal Medicine, who said, point blank, physicians are cowards. And we tweeted that, and there was actually quite a response on social media that's sort of this convenient buzzword or soundbite. And I wrote, actually, are physicians going to accept that, being called cowards? And I was really reflecting on this last night. And the other quote I wanted to share from yesterday was Alita Eck, who said, physicians are accustomed to abuse. So these are really, for me, as I reflect on them, they are invitations for us as physicians to reflect on ourselves and what we've allowed to occur unconsciously or consciously. And, you know, physicians are cowards, it's a great headline, but Dan, does the shame of being called a coward actually inspire you to act courageously?
Well, you kind of know me pretty well, I think, Lisa. Yeah, it actually kind of motivates me, to tell you the truth. I think you have to look at that and say, you know, are they right? And I personally think he was right. Sorry to say to the medical profession, but I think that is an accurate assessment. And so to me, when I hear it, yeah, it spurs me on to say, well, why is it? And then why is it perceived that way? Why is it real? And then what should we do about it?
And Dan, you're speaking as someone who's already taken courageous action. So can you tell us about, and I know you told this story in the day one, but for those who weren't there, can you tell us briefly about that moment in your life where you were inspired to act courageously in a way you hadn't before?
Yeah, I can. I appreciate the question. And I guess that might look a little different for all of us,
yeah,
right? Because we're all individuals. We all come from different life experiences. Our training might be a little different. We're in different specialties. But for me, it was the realization a year ago that because of the advent of electronic health records and meaningful use, that I was spending all this extra time. And to me, it seemed like busy work, clerical work, data entry work. It had nothing to do with orthopedics, which I'm an orthopedic surgeon, and the quality, what I would define as quality for my patients. So seeing that and seeing how I was doing extra work, especially at the end of the day after dinner with the family, it seemed to be an injustice. I said, I got to say something about this. I got to speak up because it's just not right. And so I made a conscious decision to write something and send it out to a few physicians in my community. And I got a favorable response that, wow, you said exactly what we were feeling. And then I wrote an op-ed about it, and then that kind of went viral for a few days. So that was kind of my aha moment. And that's what happened with me.
So what I hear in that, Dan, is in the moment that you were actually inspired to act, it was from experiencing something specific in your life that you saw being infringed upon, and that you had a solution for. You had a decree that would right that. And so when we talk as physicians about wanting to work less, sometimes that's perceived as, what are we saying? But what I hear you say is actually you want to spend your time doing what you love for your patients and providing the highest quality. Yes or no?
That is correct.
And so I just want to point out the word courage. Cor is the Latin root for the word heart. So when we call upon courage, we are actually inviting and asking each of you, physicians, to go into your own heart. And what Dan has shared is very important in that answer is specific and unique to each of us. So I am one that you'll notice if you watch this, that I'm always going to ask the personal experience of that person, because our generalizations don't work. We know the storyline already very well of trying to create one-size-fits-all solutions that come from an idea of solving everyone's problem. But we know in the truth of our own experience that we have specific situations. Every patient is unique. We are unique as individuals. And what I would like to observe about courage, and what I've seen just watching the parade of stories here over the last few days, is that courage is a catalyst. That when we see and hear the example of one person going into their own heart, finding their courage, listening to what their heart says, and taking action, no matter what other people may think of that, we're inspired. Not to necessarily copy that person, but to find our own courage. And that is, I believe, the evolutionary imperative that physicians, along with the rest of our planet, are being called to at this moment. So I just wanted to share a quote from Eleanor Roosevelt about courage. And it goes like this: you gain strength, courage, and confidence every time you stop and look fear in the face. You must do the thing you think you cannot do. Every single word of that is an entire book, because it's about identifying what it is you think you cannot do and then doing it. And the examples that we've heard of all of the leaders that have come onto this summit have all done that. And in the face of what was considered impossible before they took action, is through their actions doing the thing they think they can't do. So for each of you, this is the invitation I have, because when we say, oh, fear is stopping me, our fear, when we touch and love and stay with our fear, actually has the exact roadmap to our courage. So Dan, for you, maybe it wasn't fear for you that actually, maybe it was pain that motivated you. It was the pain of not having the time to deliver the quality of care and have the life that you chose for yourself. Yes or no?
Yeah, I think that's an accurate statement.
So that pain actually pointed you in the direction of a solution for that, a resolution of your pain.
Correct, and I think a recognition that while I heard some of these feelings being vented at the scrub sink, I'm a surgeon, I didn't hear them being talked about and bantered about and discussed in an open public forum. There's a difference, right?
Yes. What's been happening for you as you've been able to share your story ever since the publication of that article, all the way to being here at the summit and connecting face to face and through the internet to other people who have also spoken up? What's happened for you?
Well, a few things. One, immediately I had confirmation that there were a lot of other physicians out there feeling the same way I was, right? That's hugely confirming, because when you write an article like that, when you take a step of faith or courage, I love that you said it's from the heart. You don't know at the moment you write it or the moment you state it, am I the only one who feels this way, or do other people feel this way? And so when you get the feedback, when your colleagues tell you, boy, that's exactly how I felt, that's confirming, right? And so that was the first thing, to realize that there are other people out there who felt exactly like I did. Secondly, I think that what it does is in a way, your colleagues or other physicians realize that, well, he's right, and maybe we all need to kind of stick together or say something, or what can I do, or some thank you for saying it kind of thing. But with all, and then the final thing I would say is, as a result of that, it's always amazing in life, right? You take, whether it's a step of faith or you go off on a tangent, as a result of that, the opportunities it gives you. Like, I would have never met Dr. Strickland, who's kind of the father of this conference, and I have such huge respect for him, his motivation to put this on, his determination. I mean, he flew his plane across the country to motivate, to encourage, to put this on. So huge respect for him, and Dr. Thompson and Andrea Berry and all the people I've met, right? But for this, if I hadn't done that, I would have never met you, and you too, Lisa. Yes. So, you know, you got to look at life like, what are the opportunities that it's going to create, you know, and take a step of faith and have some heart and have some determination and courage.
Beautiful. Thank you. And I'll just share my own experience too. I've had my own experience of, you know, I'm the one who coaches people out of medicine. So I have a bit of that feeling of, I don't really want to expose myself to the larger medical profession, who may see me as some kind of a rabble rouser or threat to the sanctity of it. And showing up here and really being of support to the truth coming to the surface, and being of support to other physicians who are demonstrating courage in their own way, which does not always mean leaving the profession. It may mean working in a different way within the system to change it. I've been very inspired, and I've made new connections also with people who are like, yeah, we're all for that. And it's that magic of entering into conversation with courage, to have heart-to-heart conversations that are real. Because we are all very accustomed to playing the role and having the mask and the white coat and all the titles and all the corporate layers that tell us what we're supposed to do, when in our heart we know already. We are already what we desire to be. We already know the care that we desire to provide to our patients, the love that we have for our families, our community, and our world. And the anger that I'm seeing is that these impositions that we've agreed to are telling us, no, you can't be who you really are. You have to continue to show up in a plastic model role. So I want to go back to fear, because this was actually a comment thread on our webcast yesterday from physicians who were chiming in to say, oh yeah, fear is the thing. And I love that on the first day there was a lot of talk about, when we talked about DPC models, there was a talk about, oh, I have fear of talking to my Medicare patients about potentially opting out of Medicare. How do I do that? There was fear around that. And Dr. Cavalli brilliantly illustrated what courage is. And he said, that's my next challenge, and here's how I'm going to do it. I'm going to talk to them. And how simple is it to say, wow, I have this fear of abandoning my Medicare patients. Am I going to stay silent in my fear, or am I going to open my heart and share with those patients what I'm experiencing? Hey, I have this dilemma. This is what I need to do to keep my practice running and to continue to deliver you care. What do you think? So he's sending letters and surveys to his Medicare patients. That is courage. And it's so simple. So it doesn't mean you have to, physicians, start your own movement, create your own conference. You can do all that, get published in the Wall Street Journal. Those are all other examples. But there's small acts of courage that you can do every day, right now, in your practice. Have a conversation from your heart with your patients. We just saw in this video that another illustration that how much do you withhold from your patients? that you know to be true in your heart that you're not saying. The moment you say what's in your heart to your patient, you are practicing courage. And I would say that courage is a skill and a habit that we practice. And finally, and I'll let Dan chime in, how many of you are waiting for your fear to go away before you act with courage? Let me tell you this, it's not going to happen. Courage is acting in the presence of your fear, doing it anyway. Every time you agree with fear and allow it to win, you strengthen fear. Every time you agree with your heart and practice your courage, you strengthen your courage. What the world needs right now from all of us, I don't care what your profession is, I don't care what your title is, what the world needs now is each of us to step up to our next level of courage. Start practicing now.
That is so true and well stated. And let me just tell you, Lisa, we so appreciate you being here with us. And no, you are not a rebel rouser. But
I'm
there's
okay with
so many things going through my mind that I could respond to that. And we only have so much time left. But one is, there's a couple things I just want to share, and then maybe you can respond back. This idea of who am I? Who am I? Who defines me? Yes, I am an orthopedic surgeon, but first and foremost, I am Dan Craviotto, son of an iron worker. I know who I am, and while orthopedic surgery is a big part of my life, that is not the only thing who is me. And for all of my physician colleagues out there who are frustrated and just angered and emotional, don't let them define us. What you do counts. Every day in your office, taking care of patients, you have the ability to make an impact in your patients' lives. And that's what really counts. And while it is infuriating, and while there's a sense of injustice that those outside of medicine would tell us how to practice and what we should document, never ever forget that you hold something that they don't. You are still treating patients, so don't let them define you. Don't even go there. Still fight for what we believe is right, but don't let them define you. That's one. Second, there is something to the thing of why we don't step up and why we kind of lack maybe guts at times of how we're trained. We're all through medical school and residency. It's on rounds or whatever. There's this sense that, oh, I don't know if it's my role to speak up or what'll happen if I call someone on something. And that experience is, again, is probably different for each of us, but I do believe it's in our inner core. It's part of the DNA of coming through medical school and residency, this sense that, oh, don't say anything. You know what? Just make it easy on yourself. Just do it. Just get it done. And so we become really, really good at do the next thing. I'm going to just do the next thing. I'm not going to say anything. I'm not going to speak up. Well, you know what? Healthcare is to such a point in this country that for the sake of our patients, for the sake of healthcare, for the benefit of the medical profession, for the longevity of the medical profession, we all better start speaking up. We are the only ones who, as physicians, who can speak to what we do and how we do it. And shame on us if we don't speak up. Shame on us, because it'll be the end of our medical profession having some sense of identity or control or whatever. So that's a challenge. I think we all need to speak up.
Yes, thank you, Dan. We have a comment from the webcast, and I'd love to read this. It says, most physicians aren't afraid, but unfortunately, because of contracts through hospitals, insurance and pharma companies, monies are dangled, silencing their opinions. So I'd love to comment, and then I'll let Dan comment. What I will say to this is, usually the fear that paralyzes us is the fear we have not yet named. So you may say that I'm not afraid, but there's a fear that's keeping you there. If you can identify that it's these contracts, it's these pharma companies, we've seen many examples over the last few days of people that have simply opted out of all of those, that accept no government insurance, that make their own deals on prescription drugs for their patients, and they don't have contracts with hospitals. They deal directly with the patient. So we've seen examples of how when we drop the excuses and face what our own fear is, which is maybe the fear of starting our own business, being financially vulnerable ourselves, not knowing how to speak to a bank to get a loan. These are skills that can be learned. And, you know, maybe your fear is at midlife, I'm 45 years old, I don't want to be awkward and learning something new again. I know what I do, I know how to do it, and, you know, doing something new may be the fear. So let's face that, let's talk about it, let's identify it, and then we can individually find the steps. How do I get the information? Who are my mentors? Who is my community? Who's done this before? Every single fear is the map to your own courage and the collective solution. It's not going to come from someone up high imposing a solution. That's really important, because you see that these individuals that we've been talking to over the last few days have started initiatives. So they do need supporters, but we also need each individual to do something specific for their own practice.
Yeah, I agree with that. And it could be at the end of the day, you realize you're stuck in a situation, and you really look at it, you know, introspectively, like, okay, here's my choices. I don't like it, but the changing a career is a concern to me. Having my revenue go down is a concern to me. And it may be at the end of the day that if you honestly evaluate that, you choose to stay where you're at. That's a reasonable decision. I wouldn't argue with anyone's decision. But if you choose to stay with you're at, and you realize that there's still some things that frustrate you, all I'm asking, well, at least speak up about it. Don't hold it within. I mean, if that's your choice, and I would never, ever be critical of anyone's choice, but speak up about it, because if we don't speak up, if we don't come together, then none of this will change. And that's all I would add to that. Do you agree with that?
I do. Yeah. Those, again, tiny acts, because for that person, if it's that they see their own dissatisfaction in that situation, and their hesitation or where they're not acting is to speak about it, that's their act of courage, and that will catalyze something. And as you said so beautifully, one action can lead to so much that we're unable to imagine from the box of staying still and not acting. And yes, this is tremendous internal personal work for physicians, for all of us, but especially for physicians who, as our speaker yesterday said, physicians are accustomed to abuse. We have been systematically, over a period of decades, basically trained into being silent as the default. So this is going to be stepping out of our comfort zone to do something different and risking something, because we don't know what somebody's going to say to us. Maybe we have fear of are they going to fire me?
Yeah. No,
okay,
exactly
so
right.
we have to face that and be willing to trust life.
So we're going to move on here. Thank you, Lisa.
Thank you.
Thank you, Dr. Chu.